When our team heard about the patient-initiated follow-up, or PIFU as we tend to refer to it, we thought it was a great idea. We're always looking for new ways to work, and we're very open to different things, and this is something that gives the patient so much more choice and control of what's going on in their care, and that's what we're all about. So we started using PIFU because it gives patients choice about when they come back. It gives them time to put into practice any advice, any changes that they need to make to their behaviours or their lifestyles, and it saves them coming back unnecessarily, so it saves their time.
It's allowed me to streamline my workflow, as it were, in terms of I can see people who do need to access the clinic in a timely fashion, as opposed to people who are kind of relatively well and who wouldn't normally want to come and see me, other than the fact that they do have an appointment at that time, set a year or 6 months ago or whatever it is.
When we've got patients on PIFU, we've agreed a timescale with them about how long they've got for coming back. What that means for us is we don't book them in routinely for that appointment, so we've got that space for another patient. That could be a new patient who's waiting for treatment, or it could be somebody who's actually needing something a little bit more direct in terms of their care and support.
So when PIFU came, we spoke to the patients, we told what would happen, and we set out that if not everything is good, this is how long we will wait, which could be 6 months, 9 months, or even a year, or even longer than that. And then by the time, if everything is good, they carry on their things. But if not, then there's a very definite process of contacting us and then coming and coming for a follow-up. And what that did was that freed up a lot of review slots, and we were able to attend to those people who needed clinical priority.
The use of the patient-initiated follow-up saves on making those long reviews that you might be 6 months or 12 months down the line, which if the patient remains well, they quite often can forget about, and then they don't attend, which wastes that appointment. If we can reduce these missed appointments, that creates more capacity in your clinic to see the patients that are needing your help.
GPs are happy because they know that there's a continuity of care at the secondary care in the hospital, and we are happy that we are not having kind of wasted slots, or that sort of people who are not attending the appointment. So the space is the clinics are optimized. So therefore, I think it's a win-win for everybody.
For the patients, they have the opportunity to get directly in touch with us. They have our contact details, they get in touch with our secretaries. The secretaries will then just book them into the next clinic appointment.
And, I think patient-initiated follow-up is a fantastic idea, and the initiative has really worked, and it has really worked well for the clinicians, it has really worked well for the patients, and our colleagues in the primary care, they're also happy about it.
If you're still not sure about using the patient-initiated follow-up system, have a chat with your clinical team and see where you can identify some opportunities. See what space you might be able to create. Certainly in our team, we've found that it's just been a huge benefit, both for the patients and for us.